I'm Holly Stevens. I am a nursing student, and today I will be informing you on how to properly change bed linens and how this can greatly reduce the risk for your patients. Little do people know the simple task of changing soiled bed linens can be crucial to the rehabilitation and recovery of your patient. If they are not changed, the bed linens could potentially produce skin infections or bed ulcers. Soiled linens can also cause toxins within the blood, and that's very dangerous to your patient. It is monumental to know how to properly change bed linens for your patient. I gathered research on nosocomial infections, and nosocomial infections are infections acquired within the hospital building that weren't on the patient prior to admission. I also gathered information about painful pressure ulcers or bed sores. If you know how to properly make a bed with using correct linens, this will greatly reduce the overall risk to your patient. I will inform you on how to properly make a bed and how this proper bed making technique will greatly reduce the risk for skin shearing or skin tearing of the patient when the patient is moved or flipped, and it will decrease nosocomial infections acquired in the hospital building, and it will also decrease bed sores or pressure ulcers. Proper linens will reduce skin shearing or skin tearing when the patient is transferred or repositioned. This is a draw sheet. It is laid on top of the fitted sheet on the bed, and it is used like a hammock-like device in repositioning the patient or flipping or transferring the patient. This is an absorbent pad. It is laid on top of the draw sheet, and it also aids with moving the patient without producing skin shears, but it also, if the patient becomes incontinent, it catches all the bladder and bowel movements. If the linens become soiled or damp, you must change them immediately. This prevents the skin from shearing and getting moist and adhering to the sheets, as stated in the Risk Factors for Bed Sores 2008. If the linens are not changed, nosocomial infections could occur. When a patient becomes incontinent, they lose control of their bladder, making their skin moist and adhering to the sheets, causing tears or nosocomial infections of their own feces, stated in Risk Factors of Bed Sores 2008. If you lose control of your bowels, the bacteria in your feces can enter your bloodstream and cause sepsis, which are toxins in the blood. You can also get gangrene and have to have an amputation. And you can also get necrotizing fasciitis, which is a painful deteriorating of the skin, flesh-eating disease. As you can see, it eats away flesh, muscle, and bone. As stated in the Risk Factors of Bed Sores 2008. When you're changing linens, you want to roll them up and away and dispose them in a proper red biohazard bag. You do not want to shake the linens, clean or contaminated, because this will contaminate yourself and it will stir up harmful microbes that are already on the contaminated surface of your patient's bed and the floor. You must reposition and check on your patient for pressure every 2 hours. Pressure exists along the tailbone, the hips, the ankles, knees, toes, elbows, and the back of the head. This is when the bone presses on the skin and cuts off vital nutrients in circulation, such as blood, oxygen, and nutrients needed for the skin to survive. This begins to deteriorate the skin, and then it becomes a painful, deep tissue wound and turns a deep, deep red. This then opens up and becomes a pressure ulcer, which exposes bone and muscle, as seen in here. This is very painful to your patient, as stated by Admin in 2010. When you're tucking in clean sheets, when you tuck them in at the bottom, you lay everything else on the side. Do not tuck the side in. This creates pressure to the overall body of your patient. You want to make a mitered corner, and how you do that is you lift up, make a triangle, fold in the excess, and let it hang over. You also want to make a toe fold, and how you do this is you lift up, fold over, and this reduces the risk of pressure ulcers on your patient's ankles, heels, and toes. As you can see, the simple task of changing bed linens is crucial to the recovery and rehabilitation of your patient. This will greatly reduce skin shearing or skin tearing, nosocomial infections acquired in the hospital building, and painful bed sores. These tips are helpful to me as a nurse because I tend to work with geriatrics and they are extra fragile. Just remember, if you cannot make a proper bed, your patient is in danger for turning red.